I'd first like to thank the Pharmacy Board and the Pharmacists Association for their continued efforts to work with our government as we all collectively try to improve the delivery of healthcare for the people of Newfoundland and Labrador. Pharmacists play a vital and valuable role in the delivery of healthcare, and it's important that we all work together to find ways to improve how services are delivered and how we can make the overall system work more efficiently and more effectively for the benefit of the people of our province. Today, I am pleased to announce that the provincial government and the Pharmacy Board have signed new regulations that will expand the scope of practice for pharmacists and in turn provide new options for the general public to receive healthcare services. So what this means, consistent to a commitment we made earlier this year, pharmacists will be able to administer the flu shot, and I'll say more about that in a few minutes. The Newfoundland and Labrador prescription drug program services approximately 30% of our population. So in addition to the regulatory change I just announced, I'm also pleased to announce an enhancement to our existing partnership with pharmacists and the important services they provide to Newfoundland and Labrador prescription drug program clients. This enhancement will allow clients of the Newfoundland and Labrador prescription drug program to be able to access flu shots from their pharmacists free of charge. It will also allow authorized pharmacists to access vaccine as part of the public program for NLPDP clients. Pharmacists will also be permitted to provide vaccinations to the general public for a fee that's determined by the pharmacy. This is an important enhancement, and it responds to the public's desire to have choice and convenience in how they access this service. So we will now have a team of physicians, nurses, and pharmacists who will be able to provide vaccination services to minimize the impact of the flu in this province and to maximize public health. The regulations will allow pharmacists to provide influenza vaccines and other vaccines by both inhalation and injection. Pharmacists will have to apply for authorization to expand their scope of practice from the Pharmacy Board and will be permitted to engage in this expanded scope of practice when authorized to do so by the Board. The Pharmacy Board has developed standards intended to ensure pharmacists have the proper training and administrative infrastructure in place to offer a safe and effective service. Pharmacists will be required to undergo approved training regarding the administration of medication by inhalation or injection. I understand that a number of pharmacists have been preparing for this change, and there have been training opportunities provided for a significant number of pharmacists in Newfoundland and Labrador already. Pharmacists will also be required to have current certifications in CPR and first aid, and to have a private space available for carrying out this new service. With the influenza season just around the corner, we feel that the addition of pharmacists providing flu shots, we can increase the uptake of vaccinations and ensure that more people in our province are protected from the flu. What pharmacists will be providing is another option for individuals to choose. As a government, we are committed to ensuring that all health professionals practice to their full scope of practice. This is important for ensuring the most effective use of our healthcare resources. It also provides a higher level of service to the public and a more satisfying work environment for our highly skilled health professionals. Pharmacists are highly trained, and they're capable health professionals who contribute greatly to our healthcare system. I feel that the decisions we have made will be a benefit to the people of our province and the provision of quality healthcare in Newfoundland and Labrador. I would now like to offer Margot Priddle an opportunity to discuss the Pharmacy Board's role.
Thank you, Minister Kent. The mandate of the Newfoundland and Labrador Pharmacy Board is public protection. The board ensures that only qualified and competent pharmacists practice in our province. This new regulation is an innovative use of the talents and unique expertise of the Newfoundland and Labrador pharmacists, helping to provide increased access to safe healthcare services. Pharmacists interested in providing the injections are required to successfully complete a comprehensive training program before receiving authorization from the board to administer injections. This is the first step in optimizing pharmacists' unique skills and abilities to their full potential within our health system. The board looks forward to working with the department to further enhance the pharmacist's scope of practice equal to that of other provincial counterparts, supported by regulated pharmacy technicians. The board continues to maintain its focus on providing patients with the high-quality standard of care and services they have come to expect from Newfoundland and Labrador pharmacists.
Thank you. And I'd now like to invite Greg Batt to speak on behalf of pharmacists.
This is an exciting day for pharmacists in Newfoundland and Labrador. Last year, we presented the pharmacist option, our view of how the pharmacy profession would have to grow to meet the changing needs of our patients. The ability to provide immunizations and injections was a key piece. Today, we have made a step forward in our quest for an expanded role in the healthcare system. Immunization is a cornerstone in our healthcare system, preventing millions of cases of infectious disease each year. In the past few years, the vast majority of pharmacists across Canada were granted the authority to administer drugs by injection. Pharmacists have administered millions of flu shots to their patients across Canada, improving vaccination rates and preventing disease. In this province, we will be able to provide support to physicians and nurses who are already involved in this program. We will be able to increase access, especially in the outports where the local pharmacy is already the town's healthcare hub. Pharmacists are highly trained healthcare practitioners that are committed to our patients' privacy, care, and health. I would like to ask any Newfoundlander or Labradorian who has questions or concerns to reach out to their pharmacist. This change in our role is meant to better serve you, and we look forward to the continued changes in the role of the pharmacist, which we will hopefully see in the not-too-distant future.
There's no doubt governments right across the country are looking for innovative ways to be able to improve patient care and health outcomes. And one thing that we've been pushing for over the last couple of years has been able to utilize all those healthcare resources that are in the province, and that includes expanding the scope of practice for pharmacists, as is done in the rest of the country. Today, we are really excited, and we are pleased that Minister Kent's announcement that pharmacists will be able to be part of that bigger effort to be able to stop the spread of the flu as the season starts. We've really come a long way over the last couple of years in relation to expanded scope of practice and collaborating with the government on a number of healthcare solutions. We've moved really into an era and a tone of not just listening, but acting and doing, and agreeing and doing. And in recent conversations with the Minister and Premier Davis and several people within the ministry, everyone agreed now is the time to act, and this is the way that we have to deploy our resources effectively. And today we're starting with the flu shot, which is just the first and one of many steps. There's general agreement within the rest of the country that innovative healthcare system changes have to leverage the expertise, the knowledge, and training of all healthcare practitioners in each of the provinces, including doctors, nurses, and pharmacists. This is not about turf protection anymore. This is about ensuring and improving patient safety, health outcomes within the province. By doing this, we can lead to decreases in ERs and medical clinic waiting times. We can lead to cost savings in the healthcare system, and then we can increase the accessibility for healthcare services for patients everywhere in the province, no matter where they are. Today's announcement of pharmacists being able to administer the flu shot is really the first step. As we work with the government and the pharmacy board, pharmacists will be able to soon provide additional immunizations, injections for diseases such as shingles, HPV, and hepatitis as an example. And I'm sure they'll get into it in a little bit. Again, we're very pleased, and we have to give a lot of credit to the Minister and the Premier for being able to get this done now. We are at that point where patient safety is a major concern, and we want to ensure that patients have the same access to care and services that exist everywhere else in the country.